Hello and welcome. It's my job to help you if you are a first-time learner or if you are simply reviewing, to guide you through the Johns Hopkins Nursing Evidence-Based Practice Model and Guidelines on behalf of the Bethel Nursing Department graduate faculty. My name is Kristin Sandau, and I am happy to spend the next few minutes going over this with you. You'll need your book handy so you can take a look at the appendices that we'll be reviewing throughout this module. The purpose of this module is to prepare you so that you are feeling more confident in being able to evaluate your evidence, both for the type of evidence and the level, the strength, as well as the quality. At the completion of the module, you should be able to answer the pre-quiz questions with much greater confidence than you did at the beginning, and also be able to begin to apply this model to help you answer your own clinical practice questions. Pre-quiz, you might want to jot down your answers on a sheet of paper so that you can see how far you've come when you re-answer these questions at the end of the module. So number one, our Bethel Nursing Department has selected the Johns Hopkins Evidence-Based Practice Model for use by our graduate students. There are some other EBP models we could have used. Can you name some of these? Try naming two. Second question, why did we choose the Johns Hopkins model for our master's program? Why did we think it applied well in our setting? Question 3, can you use the Hopkins levels of evidence here? If so, please label the level of evidence for a descriptive study, a paper that you found that is an expert consensus telling clinicians what to do in a particular clinical setting. And 3, can you tell us the level of evidence for meta-analysis of both randomized control trials as well as descriptive studies included in the same meta-analysis? What level of evidence would that be according to Hopkins? And finally, number 4, can you give a level of evidence for a research study that has a sufficient sample size, some control, and a fairly comprehensive literature review? So now we're looking at a quality level, and Hopkins is using A, B, or C. What quality level would you give to a study described there? If you're like me, you want the answers right away while you're thinking about them. You don't want to wait to the end of the module. So here they are. We have other great models available. The Iowa EBP model is one that other schools, some other clinicians use. You might use yourself. There's a Stetler model. There's Wasserman and Larrabee's model for change. University of Colorado has a really great model that stresses multidisciplinary or interprofessional practice, which we're using a lot more of today, thankfully. And then there's the A-STAR model of knowledge transformation. Some of those are great models that you might be using in your own work setting. So why did we at Bethel choose Johns Hopkins? Well, Hopkins model emphasizes critical appraisal of the literature. And for most of our capstone projects, especially for our master's students, that's really the focus, is having a clinical practice question, which some of you might refer to as a PICO question, and seeing what evidence is available and what is the quality of that evidence. And so that's the focus then. It is a more robust model than simply appraising literature, but that's what we're focusing on in the context of a lot of our graduate program here for the master's in particular. So the third question had to do with using the Hopkins levels of evidence. Can you label the level of evidence for a descriptive study? That would be level 3, expert consensus, level 4, and then a meta-analysis that isn't just randomized controlled trials, but also includes quasi-experimental, gets a level 2 instead of a level 1 because it includes quasi-experimental as well. And then number 4, using levels for quality, the study that had sufficient sample size, some control, and fairly comprehensive lit review would be level B or good. And again, these are all found in the Johns Hopkins Nursing EBP Practice Models and Guidelines book. So this is a grid that shows you how the levels go from the strongest level 1 to lower levels of evidence through level 5 then. So level 1 is your RCT, so your randomized controlled trials. Level 2, your quasi-experimental, or if you're having reading a systematic review that includes both experimental and quasi-experimental, the review would then drop to level 2. Level 3 includes non-experimental studies. They can be really well-done studies, but they're not experimental. This would also include systematic reviews. So if the author's actually not conducting the research, but doing a review of other studies, and any non-experimental are included, then the study will become a level 3, or the paper will be a level 3 then. Level 4 is opinions of experts, as well as clinical practice guidelines. And finally, level 5 would be non-research evidence, such as literature reviews that are not systematic, program evaluation, case reports, and opinions of nationally recognized experts. This diagram is actually from the first edition of the Johns Hopkins nursing EBP model. And I think it's just kind of a helpful reminder confirming that clinicians do not work in a vacuum. So practice, education, and research all contribute to helping us clinicians toward the goal of providing the best patient care within the context of our organization. So in addition to formal research studies here at the center of the circle, there are also non-research types of evidence that we would need to take into consideration. There might be some organizational quality improvement data that maybe wasn't conducted in a formal research manner, but was real specific to that institution. It would be important to consider. Financial feasibility is very important, and the organization will not move forward unless there's been an analysis of what is financially feasible in change or intervention. And then, of course, we never want to undervalue clinical expertise and patient preference. Those are really important types of evidence, and they're not formal research, but they're very important. As you can imagine then. We're going to take a look at each of those levels in a little bit more detail, followed by an example from a published paper. Level 1, as we mentioned, are experimental studies, and they do involve randomized controlled trials. So what is an RCT? An RCT means that the subjects have been randomized into either treatment or control group. So as you know, when we are looking at studies, this is the strongest level of evidence. There has been manipulation of a variable, and these subjects have been randomized. Now, and level 1 can also include systematic reviews of studies of RCTs, and they may or may not have a meta-analysis. A meta-analysis then is where the authors have actually combined data from multiple studies and analyzed the data together. So they have done a statistical analysis with a large data set then. So in order for the systematic reviews or meta-analyses to be included as a level 1, they can only contain RCTs, not other types of studies from a lower level of evidence. An example of a level 1 study could be this RCT, in which women were randomly assigned to either experimental or control group for an intervention for breast cancer education. And so all of these factors were present in the methodology: randomization of the subjects, there was an intervention that was manipulated, and there was control. So this would be a level 1 RCT. Evidence for level 2 would include quasi-experimental studies or a systematic review that contains quasi-experimental studies. They may have RCTs, but if they have quasi-experimental studies, then they become a level 2. How does a quasi-experimental study differ from an experimental study? Well, there definitely is an intervention in a quasi-experimental study, but there's something lacking. Either the study design is missing randomization of the subjects or a control. Examples of level 2 could include a study like this one, for example, where participants were recruited through the deaf community and were assigned to either intervention or a comparison group, but they weren't randomly assigned because the deaf community needs to be small and closely knit. They were not able to do randomization to the intervention or the control. They still were experimental, but not randomized. Level 3 includes studies that were not experimental. So what comes to mind are descriptive studies maybe that were using a survey or observational then. And of course, would include systematic reviews of such studies. Even if the reviews also included RCTs and quasi-experimental studies, if they do include non-experimental, they're going to be a level 3 systematic review. Level 3 also includes your qualitative studies then, as well as a metasynthesis. What is a metasynthesis? A metasynthesis is where the authors have summarize findings from qualitative studies. So that differs from a meta analysis in which the authors have combined analyses from quantitative studies. Examples of level 3 evidence would include, for example, descriptive studies. And here's a convenient sample that was recruited from large centers. So really nice, diverse, large sample size. But they're completing surveys. There's no randomization. So it's a descriptive study. Another example could be this qualitative study, which is also descriptive in the sense that people with implantable cardioverter defibrillators or ICDs were asked about the lived experience of having an ICD. And level 4 evidence would include opinion of respected authorities and nationally recognized experts. So this could include consensus panels, and they could have wonderful tables in which they have looked through the evidence and come up with guidelines. Specific examples online that you really would want to take a look at are available through the National Guideline Clearinghouse here in the United States. The Agency for Healthcare Research and Quality is really important for looking to see, as you're beginning to research your clinical question, what's already available, what we already have out there for guidelines. And then, of course, for our midwives, the National Association of Certified Professional Midwives, looking to see what guidelines they may have already that exist. And then from the UK, the National Clinical Guidelines Center is really helpful as well. Level 5 is based on experiential and non-research evidence. And this would include literature reviews that don't include a systematic methodology where they're not skipping any of the studies in their included criteria. So lit reviews, quality improvement program or financial evaluation from an institution, case reports, and opinion of experts based on their own experience. Examples of level 5 could include, for example, a literature review as listed here. We do want to point out that different textbooks as well as different professional organizations have different ways of categorizing levels of evidence. And so you need to choose the one that fits with the organization or purpose. So we've chosen Johns Hopkins for use here at Bethel for our students. But your own healthcare organization might be using a different model. They might be using the Iowa model, for example. So just to be aware of that, I know that the work that I have done recently with the American Heart Association, we use their own, a different level of evidence and quality of evidence rating that is from the American Heart Association. And so you use the one that you need to use in the setting that you're in. So how can we use these evidence levels to appraise research findings? We need to start getting practical here. In your text, there are lots of appendices, and you need to become familiar with them. So grab your text and perhaps a sample piece of evidence that you're going to evaluate. The first thing that you need to decide is your evidence research? If it is, you're going to be working with Appendix E in the back of the book. If it's not research, you're going to choose Appendix F. You need to make sure you're using the right appendix first of all. So let's start with Appendix E, the Research Evidence Appraisal Tool. So this is going to help us to be able to look at the type of evidence. And so the tool starts with listing the reference. You want to skim that abstract and make sure, is this even applicable to my practice question? Here you've got your example of what you're going to be filling out. For number in the top right, you may or may not use that. It may happen that you're going to actually delete a study that you thought you might use after taking a look at it. So it will change your order number. So you're going to choose when you do your review, when you present your review, if you're going to use a matrix, for example, you're probably going to do it by year or author. So you're going to have a order then. So as you take a look at the setting and the sample, That's going to help you later on as you think about the strength and limitations then and how it applies to your EBP question then. And you'll be filtering out as you look at your titles and your abstracts in your early literature review. Appendix E then, if you were looking at a research type of evidence then, the first thing you do is is this a report of a single study? If it is, then you're going to decide whether or not it is a level 1. So you're going to know, number 1, is there an intervention? Number 2, is there a control? And 3, was there randomization? That's really important then because you're finding out if it is a RCT, then it's a level 1 evidence. If not, you're moving on then. So it could be quasi-experimental then, which would be a level 2 if there has been some manipulation of an independent variable, but lacking randomization or control group, as we discussed. And then if not that, then it might be non-experimental. There has not been manipulation, or perhaps it's a qualitative study. So those would be level 3 then. Now we're going to take a look at, was your study a systematic review then? Perhaps you were reading a study that included, a paper that included many, many studies then. If it's a summary of multiple research studies, then number 1, did it employ a comprehensive search strategy and rigorous appraisal method? And if that's the case, then you're going to see, is there a meta-analysis or meta-synthesis in it? So those are a couple things to consider. Now, going back, if you actually don't have a summary of multiple research studies, you're probably using the wrong form. You probably want to be using the non-research evidence appraisal form at this point. So you can see how this is kind of a flowchart that's going to become more familiar as you use it then. So the bottom half talks about for systematic reviews, then you want to be able to level it. If they're all RCTs, it's a level 1, as we discussed. If it's a combination of RCTs and quasi-experimental, it's a level 2. If your systematic review includes non-experimental as well as experimental or qualitative studies, it's a level 3. Finally, let's see if this study can help you answer your research question or this evidence piece that you have read, and what were the key points there. At the end, you want to have nice clear bullets that you've done systematically so that you can pull things together and synthesize at the end of your data gathering. Now that you've determined level of evidence for that piece of evidence that you looked at, you need to decide what the quality is. So then you can, for a research study, use the following questions to help you appraise the quality. So you might want to hit pause and take a look at those questions. The quality ratings are A, high quality, B, good quality, and C, low quality or major flaws. Now, if you are using non-research type evidence, you want to be using Appendix F. And so that's what this form is. So again, you're taking a look at, does it answer my question? I'm going to proceed with spending the time to review it after looking at the abstract. You might, for example, be looking at a level 4 that is a clinical practice guideline already developed by an organization, or a consensus or position statement that's already developed then. Perhaps you are looking at a level 5, a literature review, and there's no systematic way that they're including or excluding studies then. That brings it down to a level 5 then. And then here's some sources that you can use to evaluate it. Or perhaps you're looking at expert opinion and editorial by an expert. Level 5 also includes, finally, quality improvement, financial evaluation, and program evaluation. So you can take a look at the setting, the sample, and some of the critiques that you would want to make, as well as for a case report. And finally, community standards, clinician experience, or consumer preference are important to take a look at in the whole picture of things. They are a level 5, and we want to know that the source has been credible, opinions are clearly stated, and practices identified are consistent. You want to take a look too for bias and how they were sampled and who was sampled. What findings might help you answer your clinical question from here? Bullet them out so they can help you later. Appendix F then gives you quality ratings for the non-research evidence that you reviewed, and they are, again, A, high, B, good, and C, low. And then the same A through A, B, and C are listed depending on what piece of evidence that you've been reviewing. So that's a good start. We got a lot done. You'll want to spend some more time looking at the rich resources in this text then. So we've focused primarily on using the model to evaluate the level of evidence and focused on research evidence, Appendix E, and non-research evidence, Appendix F, and some quality appraisal. Take a few minutes to go back to the pretest questions again and try to answer them perfectly without any notes. Then later, when you are ready, you'll want to be aware that other appendices are very helpful, like Project Management Guide, Appendix A, Appendix B, Question Development Tool, which you might have already done in a class. And then G is Evidence Summary Tool, and H is Synthesis and Recommendation Tool. They may not be required by your professor, but some of you that really prefer to work systematically might want to use those tools as you put together all the information that you have to write your a capstone paper, for example. You will become more comfortable more and more as you use this model and these guidelines. And certainly some of the rating systems, you're going to want to be talking with someone else as you apply it to a particularly challenging piece of evidence. So go ahead and talk with someone about it. And as you go to conferences and are becoming more involved in your own professional organization, take a look at how they are rating evidence and how they're appraising evidence.